observed worldwide as Breast Cancer Awareness Month, a time dedicated to spreading knowledge, inspiration, hope, and encouraging early detection of timely care. It is indeed a matter of pride and purpose that we have gathered here today to observe this important occasion through a special awareness session in association with Rodali, a Center for Cancer Awareness and Counseling.
Today is a very important day because we have our, the speaker, a well-known speaker on oncology, that means cancer. And this month is significant because it is a breast cancer month. See, it is not that every woman or girl should know. Even the boys, we have a few boys here, even the boys should know about cancer.
Good afternoon, dear students. I'm very honored. I'm really glad and delighted to be here at USTM. Thank you, Professor Gayatri, for giving me this opportunity to do something that I love the most, and that is talking to young people. If detected early, breast cancer, at least for breast cancer, we can say it is 100% curable. So how many people are likely to have cancer? And in Kamrup district, in females, 1 in every 5 person in your lifetime are likely to have cancer. So if you make yourself in little groups of 5, okay, including me, anyone, any in a group of 5, one of us are likely to have cancer, a cancer in our lifetime. That is the statistics. This is not what I am saying. This is Indian Council of Medical Research. It is their data based on extensive population-based cancer registries and hospital-based cancer registries, which are actually counting this number. Now, why do our patients come in late? Why is it that we have a patient coming in with a stage 4 disease? One is ignorance, lack of awareness. Nobody has told them everything. They never heard about it. Poverty, money factors. I have something with Dr. Bale bole to आपको 500 टाका fees है नहीं वो medical बोले जितने दिन जाओ ticket बनाओ देखो line बनाओ I don't have time. So all these factors come into play. A false sense of modesty. I'm a breast pussy and why have that product That's a very common reason. With young girls. Fear of losing the breast. Somebody will say, oh, breast is done to anything. Hey, doctor can bole, but your breast may touch it. If your breast to touching what will be left in your infirmity? If it is cancerous, then breast to side a very, very false perception. Yes, we remove the breast, but only when the disease has gone beyond a particular stage. Not in an early stage breast cancer. Early stage breast cancer, your breast can be preserved absolutely flawless. Today, I request all of you to go home and spare 5 minutes on the YouTube. You must be spending so many hours on Netflix. But if you can spend just 3 minutes on the YouTube or from a breast self-examination video, it won't take more than 3 or 4 minutes. You will at least know the procedure, how you can do it, and you don't have to do it every day. You can do it once in a month. That's it. And that is the best solution. No doctor, no nothing, your hand. That is, no x-rays, no ultrasounds, nothing. Just these fingers at birth. So, what are the things that you will see on a self-breast examination? We have some more slides on that. So, you can do it at home on the first day of every month for a menopausal woman. But for a menstruating woman, you can do it on the 5th day or 6th day, that is after the menstruation is over. Because you can have a reminder on that particular day that my periods are over. Today, let me do a self-breast examination. Not only for that, because just prior to your menses, your breast might be a little lumpy. There might be some granularity, and you may have a false perception it's a lump. So always do it immediately after your periods are over. So that's the best day to perform the self-breast examination. And if you have to do it in your bathroom when you're taking your bath, if you have a mirror, well and good, and ideally put some soap in your hands and then palpate, because that's the best way. That's the most sensitive way to palpate or feel a breast lump which might be hidden under the skin. So basically, there are some, as I said, you go through the videos. There are rotation movements all around the breast, and you have to cover all the quadrants. Regarding the breast, every breast into 4 parts, right? two horizontal lines, one going like this and one going vertically through the nipple. And then each and every quadrant, here are 4 quadrants, every quadrant you will palpate with these fingers. Okay? Use the right hand for the left wrist and the left hand for the right wrist. And again with the right hand, go posteriorly to the axilla. This is your axilla. And try to see if there are any swellings or lumps there. Again with this hand, go to this axilla. So this is how, and also look at the symmetry of the nipples, whether they are symmetrical, any dimpling, any inward pulling, any asymmetry. So all these things are important to look at. Let's not take our lives for granted. That's the message. We often think that Sonia says, okay, it is done, but you are a precious life, each one of us. We all are precious. Let us not take our lives for granted, which means that we need to take care of ourselves. When you learn to take care of yourself, you will be able to take care of those around you. If you are not well yourself, there is no question of you being of somebody else's support, because you yourself are struggling, you yourself are suffering. So make sure this talk is to empower each one of you to become the healthiest version of yourselves, so that not only you remain healthy, you are also able to spread good health and care and compassion around you. I really want to thank the extremely beautiful women, doctors who live with us today. We are getting younger and we are getting older. So thank you so much for being with us, and especially our gratitude goes to Dr. Dashley for your enriching talk. From her lecture itself, we could understand how selflessly she wants to help women like us in the society. I don't know if you students actually heard her lecture or not, but you will see the genuineness in the way she presented the presentation. So, ma'am, for that, we are very grateful.